Here is my colleague Jellis Bollens.
Here is my colleague Beatrice Moscoloni.
And today we're here to talk a bit about our research field, which is personalized medicine in the cardiovascular field.
And personalized medicine is about finding the best treatment option for every patient individually, because every patient is of course different, and also the best treatment option therefore differs between every patient.
Personalized medicine looks different based on the application, right? What does it look like in your case?
Yeah, in some individuals, the aorta, which is the main artery from which blood exits the heart towards the rest of the body, is enlarged. So the diameter of the aorta is increased. And just like in a balloon, if you inflate a balloon too much, also the aorta can burst. Of course, we want to prevent this, and this can be prevented by undergoing surgery. But the question is when to plan the surgery. And nowadays it's planned typically when the diameter of the aorta increases a certain value. But however, it has shown that this value is not optimal to be used. We are looking into improving this diameter criterion into using other metrics or other diameter criteria for each individual specifically. What does it mean for you in your application?
Well, my research is mostly focused on sex differences and sex bias in cardiovascular research, and that's because a lot of trials have been unbalanced. So we don't know about female cardiovascular system as much as we know of men. But we know that, for example, when they go into heart failure, they get diagnosed later and with worse symptoms, and they even have worse prognosis. What we really want to do is understand this variability better so that we can improve the management of women with heart failure.
Interesting.
Basically, I'm trying to improve the management of women with heart failure. We're trying to improve the management of people with aortic aneurysm. But how do you actually see or envision this happening?
Yeah, for this we use computer models, or with a fancier name, digital twins, where we in fact, for example, take the aorta, put it into a computer, apply a blood pressure. So we do some mathematical calculations on it and see how the aorta responds to it. And so with this we can predict how the aorta evolves over time, how it ages in fact.
That's pretty cool actually, because what you're trying to do is to predict over time. What I would really want to do is something similar. So I want to use these digital replicas so that I can input there all these differences that you see between male and females. And then with similar inputs, as you're saying, so for example, blood pressure, I can understand how and if women actually do respond differently to these inputs, and then why they will be, for example, developing heart failure more.
Yeah, and so we can get an insight in how every patient individually differs from one another.
Yes.
We're using digital twins as a research platform to investigate sex differences in heart failure, right? But we can go even further. We can investigate how small cellular scales interact with large organ scales and how they can contribute to developing diseases.
But that's really cool, because in a predictive sense, then you can even give clinicians more information on more levels.
Yeah, indeed. We are doing this interesting research in a research group called BioMMedA, part of Ghent University. However, I'm also collaborating with Guy Leuven with the soft tissue biomechanics group.
And I'm also part of the Berlin Club at TU Delft, and together we are collaborating in a bigger European project called Vital,
in which we collaborate with European institutions and an institution in New Zealand.
So if you like the sneak peek that we gave you today and you're interested in knowing more about how these models are shaping the future of healthcare, visit our website
and follow us on LinkedIn.